As we talk about aging in the upper 1/3 of the face, we talked about brow lifts and we talked about upper blepharoplasty. We've already discussed brow lifts, so that leaves us the other big category of procedures, which is upper blepharoplasty. So blepharo is the Greek word for eyelid. Plasty means change the shape of, so upper blepharoplasty is surgery of the upper eyelid. When we look at surgery of the upper eyelid, that surgery primarily addresses excess skin with excess fat. Now that's kind of an overgeneralization of the surgery. In essence, the surgery normally is done under local anesthesia. It takes about 30 minutes to do. However, there's a lot of nuances in upper blepharoplasty surgery that really need to be taken into account. For example, first of all, everybody's eyelid shape is different. So if you can imagine someone who's Chinese versus someone who's Caucasian, they have different eyelid shapes. They have different amount of skin folds show. They have different variations in a double eyelid crease. So all of these variations need to be put together to cohesively come up with the plan for the upper blepharoplasty. So there isn't a one-size-fits-all, just whack out some skin and some fat. It really is a lot more artistry in order to see A, how much skin can be removed, how much fat needs to be removed, what type of eye shape are we trying to achieve. So all that gets put together in order to determine the exact type of blepharoplasty and the exact incision type. Most of the time what I end up doing is an incision that's based in the natural eyelid crease. It extends out laterally to grab some of this excess temporal skin. This type of surgery normally, as I said, takes about 30 to 45 minutes. Is done under local anesthesia. Most patients can return back to normal activity within a day or so. They come back to my office about 5 days later to remove the sutures and can be basically back to doing all the things that they do pretty quick. So it's actually one of those procedures that has a very high index of suspicion, index of satisfaction, and patients love it a lot because it's just easy to do. I hope this has helped, and this is a lot of information about stuff you can do for aging in the upper 1/3 of the face.